So, so we are continuing with acute inflammation. So the thing we are going to discuss now is the inflammatory mediators, especially in acute inflammation. This is an umbrella topic. It covers certain portions of biochemistry too. So I wouldn't say that you are going to get a specific question from this. If there will be a question, it might be classifying inflammatory mediators, this question directly, but I would surely recommend you to study this because it's an important thing to understand how inflammation and, in fact, the whole pathology and pharmacology takes place. Not wasting any more time, inflammatory mediators, we have first cellular mediators and then we have plasma mediators. The plasma mediators are synthesized in the liver. These include bradykinin and complement. Now, the complement pathway, it's better if you read it from microbiology. The thing you should remember in patho is more than the pathway itself, the functions of the pathway, the functions of the membrane attack complex, and the total diseases or the total pathologies which are related to the dysfunctioning of this complement pathway. Moving on to the cellular components, we have preformed components and we have newly synthesized components. In preformed, we have histamine, serotonin, heparin, and lysosomal granules. Now, small details about every one of them I'm going to mention. Histamine, the richest source, is the mast cell, and it is synthesized from an histidine and amino acid. Also, what are its functions? So, histamine is a very potent bronchoconstrictor. It is a very potent vasodilator, and it also increases the permeability of blood vessel. If you just correlate a little bit, I've already said that in acute inflammation we see something known as tumor that happens due to this increased permeability, and the tissue leaks from the vascular compartment to the tissue compartment. Then we have serotonin. Serotonin, also the richest source, is the platelets. Serotonin is also known as 5-hydroxytryptamine. You already know that. And it is also derived from EC cells or enterochromaffin cells. Then we have heparin. The richest source is the mast cell again. And then we have the lysosomal granules. Here you have to know a little bit in detail. The primary granules are also known as azurophilic. The secondary granules are also known as specific. So S for second, S for specific, you can remember it in this way. And the third uh, or the tertiary granules are also known as C particles. So 3C ABC. So you can also remember this like that. So the primary granules are known as azurophilic granules, the secondary granules are known as specific granules, and the third or the tertiary granules are known as C particles. Now we are going to see what are the granules. So the primary granules, we have MPO. MPO stands for myeloperoxidase, is what MPO stands for. And then we have defensin and cathepsidin. And in secondary granules, we have lactoferrin and lysozyme. So to remember this lacto, you can remember as lacto. So it will help you remember. And for gelatinase, see, it's a C particle, so you can make this C a G and remember it's gelatinase. This is how you can remember the lysosomal enzymes. And this finishes the preformed part, and in newly synthesized part we have a nitric oxide. This is synthesized from arginine, of course. You've already studied in biochemistry, from an enzyme called nitric oxide synthase. Then we have platelet activating factor or PAF. The functions of this PAF, if I mention, it's a very potent vasoconstrictor and it helps in platelet aggregation. Then we have cytokines. We'll discuss this cytokine part only in a little bit detail because it's something you don't read very well in the biochemistry part. And then you have the arachidonic acid metabolites. These are basically my leukotrienes and my prostaglandins. So this is already finished in biochemistry. So you just have to know the various function of leukotrienes and prostaglandins, like PGE2 for pain and fever. PGI2 prostacyclin is a vasodilator and an antiplatelet aggregating molecule. Thromboxane A2 is a vasoconstrictor and a platelet aggregator. Like this, there are some certain parts. F2 alpha is involved in inflammation and chemotaxis also. So this is how you'll have to study this part. And now we are moving to discuss the cytokines. So these cytokines are also my mediators of inflammation, which are newly synthesized, which are not preformed. So there are many cytokines which you will study. It's a practically very difficult task to remember. So here I have presented a compilation, but it will be better as you move on to the systemic pathology to slowly learn them along the way. Here, if I have to say that there are some things you have to remember for sure, I would say that remember for fever interleukin 1, at least one you can remember. Anti-inflammatory, so anti and 10, so you can at least remember interleukin 10 in this way. Then eosinophil activation, you have to remember this, so you can remember this since it's 5, then A, B, C, D, E. E for eosinophil is the fifth letter, so you can remember like this. This part I wouldn't say is important, but these three I would suggest that you mug it up or remember. It's better if you remember everything, the whole part only, but even if you can't, then this part you should remember. And then there is an important interleukin 6, which regulates the active phase proteins. Now this active phase protein increase or decrease when inflammation takes place. So how much is the increase or how much is the decrease? Basically, if there is an increase of 25%, I consider it a positive APR. And if the increase is less than 25%, or sorry, the level of this acute phase protein is decreased by 25%, I consider this a negative APR. So the examples you can remember 2 3 from here. You have C-reactive protein, it's a very famous one. Ferritin is there, hepcidin is there, fibrinogen is there, and then here we have transferrin is there, transcortin is there, transthyretin is there, albumin is there, antithrombin is there. So you can remember 2 3 names. If a short note comes, you can write. So finishing with the interleukins, now moving off to TNF alpha. TNF alpha has three major functions. So you can remember the one function, that N, no appetite. So it decreases appetite. Then it is associated with cancer cachexia. Cancer cachexia basically means the loss of fat and muscle in a patient that is suffering from cancer. And also it is associated with septic shock. Now moving to interferon. Interferon, I would say the most important part which you have to remember is interferon gamma. Interferon gamma has two main functions. One, it is associated with granuloma formation or granulomatous inflammation that you will study later. And the second one is it is associated with chronic granulomatous disease. So when you see interferon gamma or G, I would say you can go to from gamma to G to granuloma, or anything that is associated with granulomatous inflammation. Now, in chronic granulomatous disease, basically, what happens if I explain to you in short, there is a mutation in the FOX gene. This FOX gene basically codes for my NADPH oxidase enzyme, which is responsible for destruction of microbial antigens or bacteria in general by phagocytosis or by respiratory burst. So in this disease, due to the mutation in the FOX gene, there are recurrent infection, especially by catalase positive bacteria. So this would conclude my inflammatory mediators. This table is the most important, I would say. Even if you don't remember the details, try to write and mug up the flowchart. It might come as a question. And this cytokine, the ones that I mentioned, try to remember them, but it will be better if you try to remember them as you progress through the systemic part. Thank you.